Hi, I'm Dr. Olga from the Gentle Foot Care Center here in Highlands County, and I want to go over diabetes awareness. November is National Diabetes Awareness Month, and I'm going to go over some diabetic foot tips to keep 5 toes attached to each foot attached to each leg, because we like matching sets. I want to tell you that the United States alone has 28 million diabetics, and of those 28 million, half means 50%, are going to develop what's called diabetic peripheral neuropathy. And our goal here is to take care of that, take care of your feet, avoid diabetic foot problems such as diabetic neuropathy. 3 things I want to go over. Diabetes, it attacks the eyes, it goes after the kidneys, and it goes after the feet. Diabetic retinopathy, you could end up having vision problems, lose your vision. So of course you're going to go to your eye doctor. Kidneys, you might be seen by a kidney specialist, a nephrologist. Why? Because if you have kidney disease, you may end up on dialysis or a kidney transplant list. And with your feet, you probably have heard diabetics are prone to losing a toe, a foot, or a leg. Now you may be wondering, well, how does that even happen? Well, I'm going to explain. Diabetics in particular are prone to what's called diabetic neuropathy. Neuropathy, the nerves all the way to the tips of the toes get damaged. And when that happens, the person may develop a whole spectrum of different sensations. Numbness, burning, pins and needles, tingling, different sensations. I've had people say they feel like they got ants on them, or maggots or worms inside their toes. So if you are experiencing anything like that, definitely make an appointment to see your podiatrist, your local podiatrist, and tell them what's going on with your feet. So you go to the foot doctor. What are you going to expect? Well, one of the things we're going to do is we're going to get a monofilament wire, and we're going to check the sensations in your feet. Protective threshold. Second thing, we're going to get a good old-fashioned tuning fork, and we're going to check the vibratory sensations in your feet. So we're going to check to see if you respond to all those. Believe it or not, there are people who come in that totally fail this test upon their first visit with us because the neuropathy is already so advanced. Now, what are you not going to do? Well, you're not going to do any bathroom surgery. So you got a corn on your toe, you're not going to do this on a callus, and you're not going to get in between the toes and do any bathroom surgery. Why? You could end up with a sore that doesn't heal and end up with an amputated toe or a very long-term difficulty healing wound. What else are you not going to do? You're not going to put, yes, I know in Florida it gets cold, 1 minute of the year, but you're not going to sleep with a heater next to your foot on those chilly nights. Why? Because you could burn your foot. You're not going to go barefoot. Invest in a good pair of house slippers or sandals, and definitely do not walk around outside when the sidewalks or your back porch is super hot, because you could actually burn your feet. You're not going to use hot water. Now you're saying, well, how do I take a shower? Lukewarm water on your feet. I've actually had people who have scalded their feet in the bathtub. What are you going to do? You're going to inspect your feet every day. It's going to take a minute, that's all. If you are not able to reach your toes and look in between your toes and check your nails for any ingrowns or infections in the toes or sores popping up or on the bottom of your foot, or a funky blister or a callus that wasn't there before and now it's kind of brownish discoloration, that means it's actually getting blood building up in it. Pussy drainage, purulence. If you're not able to do that, then let's get a mirror. Let's hold the mirror and be able to look at the feet. But let's say you're like, hey, I can't see. Grab a mirror from the dollar store, put it on the ground and hold your foot over it. Now, why are you going to be doing that? So you can hold your foot and check to see if there's anything odd, like we just talked about. How often should you see your podiatrist? Once or twice a year. Now, if you are having problems with your feet, your podiatrist will probably schedule you more often. If you were just diagnosed as diabetic, your family doctor will probably go ahead and refer you to see your local podiatrist. But hey, you could also just pick up the phone and call directly for a diabetic foot evaluation. There's things you can do. A approved cream by your podiatrist to put on your feet. Why am I saying approved? Because there's stuff that's over the counter, like medicated corn pads that have salicylic acid, that are big no-nos, because they will actually burn a hole in the skin in your foot. There's healthy vitamins, supplements that you could take for your feet as well. And just remember, your doctor is only a phone call away. So if something's not right, something doesn't look right, something doesn't smell right, something's just, you got a instinct that something's just not right with your feet, call and make an appointment ASAP. So remember, this is National Diabetes Awareness Month, and at the Gentle Foot Care, we're all about healthy feet are happy feet.